So welcome to the March Northern Virginia Health Policy Forum. I'm John Voorhees. I'm Senior Vice President here at Applied Policy. Here at Applied Policy, we focus on helping healthcare providers sort through the myriad of policy challenges that come from the federal government. We host these monthly gatherings to help promote a dialogue about current issues in the health policy space. So we heard at the beginning of the Biden administration, we heard that he made many directives, changed and extended the health exchange deadline. And now his administration is focusing on other priorities, in addition to confirmation of his appointees, but also a pretty big list of other items that he's got to address. COVID, Medicaid expansion, changes to the Affordable Care Act, drug pricing, just to name a couple. So today we are pleased to have some experts here to help us sort through some of these topics. All three of our panelists today are true DC insiders, and they understand the political community, and I'm sure that we're all going to learn a lot today. So joining us today, we have Emily Porter, partner at the Nichols Group, Melanie Nathanson, partner at Nathanson and Houck, and Shane Doucet, principal at Doucet Consulting. So what I've done today is I'm going to ask each of the panelists to provide just a little bit of a background about themselves and the work that they do, and then take a few minutes to talk about what they think are the important healthcare related issues that the president and Congress faces. After that, we'll get to some questions, and we'll have the panelists opine a little bit about some of the specific things that we think are important, and there'll be an opportunity for the audience to also chime in and ask some questions. And so if you have questions that you think of something while we're on the program here, just send me a chat through the Zoom, and I'll try to work in your questions as we have the opportunity. So without further ado, I'm going to start maybe with Shane. Could you start off and tell us just a little bit about yourself, the work that you do, and what you think some of the major things that the administration is facing today?
Well, first of all, thanks everyone. It's great to be with you, John, and Applied Policy, and my colleagues, Emily and Melanie, on this conversation. My name is Shane Doucet. I am principal at Doucet Consulting Solutions, and I first came to Washington in the, I think it's the 105th Congress, to work for Blue Dog Chris John, who eventually became the co-chair of the Blue Dogs, and spent about 3 years with him on one of the key healthcare committees, House Energy and Commerce. And then I went to the National Federation of Independent Business, where I was sort of the token Blue Dog Democrat there for a few years, and worked on healthcare, tax, among other issues. And then from there, I went into consulting, principally working on healthcare issues, mainly at CMS, HHS. A lot of my work has focused on population health. A lot of that work went into the Affordable Care Act. I spent a lot of time working on provisions of the Affordable Care Act as related to employer wellness programs and other things that were kicked to the NAIC. I'm also in the DC National Guard, and I'm a lieutenant colonel, and that has kept me pretty busy as of late, especially since January 6th as well. And I'm also very passionate about the health and welfare of our military population. So it's great to be with you. What I thought I would do is quickly just kind of go through some things that I think would have a somewhat of a chance of passage in this makeup of the Congress. So I've basically kind of done this theme as what we can expect from the Biden administration and congressional Dems, and then what I think has a chance for enactment, and then how I think the sausage making process will unfold, both through regular order and budget reconciliation. Basically starting off just kind of looking at what realistically the Biden administration and Democrats think can be achieved. They really kind of started off, given the makeup of the 50-50 Senate and the slim majority in the House, is really kind of looking at budget reconciliation as a tool, particularly in the Senate, to pass things much like we did in the Affordable Care Act in 2010. So essentially, the Biden administration and Congress has 3 bites at the budget reconciliation apple. When you look at fiscal year 21, 22, and 23, the first one was just an appetizer at 1.9 trillion, which was the American Rescue Plan Act that we recently passed. And then I'll talk to you a little bit in the context of what might likely happen for fiscal year 22, and then what, if it doesn't happen in 22, what we could expect maybe in a budget reconciliation in 23, if there is one at all. First, I'd like to just kind of point out the obvious in that, and we're not out of the woods when it comes to the pandemic. And I seem to be reminded of that every day. Just in the military, we're seeing about 30 to 40% of the military members not take the vaccines. We cannot make it mandatory under the emergency use authorization. So vaccine hesitancy is going to be a real problem, and it's going to be something that the administration is going to continue to address. Just last week, I was talking to a doctor friend of mine who's tracking King County in Seattle and some of the COVID testing, and he was telling me that just in the county there, they've tested for all 5 new variants of COVID. And of course, the B.1.1.7 variant is expected to be the predominant strain, and it's more lethal than others. So like many of you, I was hoping to have a semi-normal summer. I'd love to coach my girls' CYO basketball team, but it looks like we're still going to be dealing with this. And I talk about the context of the pandemic because so many things evolve around it, such as the PHE and waivers, and certainly legislation too, because this has just been such big focus for everything that we're dealing with, and it will continue to be. The states and localities are waiting to find out what the Treasury guidance will be and how they can apply some of the cities and counties for some of that money. And of course, Secretary Becerra is going to be spending a lot of time. They're going to be getting money soon at HHS to ramp up vaccinations and other things. With that. So my point is that the Biden administration, this has been their priority. They're focused like a laser beam on it. They're not going to get complacent, and they're going to continue, to focus on it while they also try to do other things. So the next big thing that Congress is going to take up is the infrastructure jobs bill. President Biden will be in Pittsburgh next Wednesday, touting the Build Back Better plan, which has a price tag of about $4 trillion. And we expect, the skinny budget next week to come out that will sort of show us kind of where, some of the funding would go to pay for something like that, such as corporate tax rate increases, capital gain increases, among some other things. We have not passed a gas tax since 1993, and there's a reason for that. Republicans are not going to like these pay-fors. So this is something that may pass the House, but certainly is going to run into hurdles, in the Senate. So with that, House Democrats and Speaker Pelosi has been talking about their infrastructure plans, which really revolve around their bill in the last Congress, which was HR 2, which was their green energy project legislation that they passed, and HR 3, which is their drug pricing bill. And they're looking to perhaps combine these two bills as a vehicle to move potentially through regular order. We don't know, but most likely through budget reconciliation. The HR 3 bill, is a drug pricing bill. It does a lot of things. It allows Medicare to negotiate for drug pricing and other things like that, and places caps on costs associated with Part D. And it scores around $450 billion. So the Democrats are looking to use that savings to perhaps go in and pay for community health centers and human infrastructure projects, and sort of tie that into the infrastructure bill. So the next bite at the budget reconciliation bill could actually be, this vehicle, this massive infrastructure / drug pricing bill, which potentially could include other things such as age 60 Medicare, extra benefits, public option, and other things. So people are going to, all of us are going to be tracking that, as it makes its way, through that. And I'm happy to talk more about the details of that later on. And I'll quickly sort of wrap up kind of where I see things going. So that is one potential possibility for the fiscal year 22 budget. When that gets released, we think sometime in May, is to have this budget reconciliation where some of these healthcare provisions would be included in that. And then for things that don't get in that, then you're also looking at next year before midterms, and depending where the midterms go, you could also have a cleanup budget reconciliation act that could also include other things like that. The Budget Reconciliation Act really avails itself not only to spending revenue, but Medicare in particular. So things that weren't that members couldn't get back in 2010 in the Affordable Care Act, such as age 55 Medicare, which came close, and other things, it certainly could be a possibility to be included either in this budget reconciliation or if they do one for fiscal 23. So with that, I'll turn it back over to you, John.
Thanks, Shane. Wow. Appreciate that. That's a great rundown. I wish I were just taking notes. Before I move it on to somebody else, just a reminder to everybody to please put yourselves on mute. In the land of Zoom, I know that I've had dogs barking in the background of me sometimes, and so would appreciate it if you could just put it on mute.
Sorry,
Melanie,
John.
let's step up to you.
Melanie or Emily?
I'm sorry, Melanie.
Okay, it's fine. Both are good. Thank you so much, John, for having us. And I am so pleased to see everyone from Applied Policy. You guys are just incredible experts, and I know just make everyone's lives a lot more informed. So thanks for having us be a part of this today. My name is Melanie Nathanson, and I am partner and founding member of Nathanson and Houck. We are a boutique healthcare and income security consulting firm here in Washington, D.C. I, like Shane, worked on the Hill for many years, both for Bob Graham, senior member of the Senate Finance Committee, as well as Sandy Levin of the Ways and Means Committee, who ultimately chaired that committee. After that, I was the co-lead for healthcare policy for the Center on Budget and Policy Priorities here in Washington, D.C. And then came back after working at Miami Children's Hospital as part of their senior leadership to run their federal budget initiative. I went on to found the healthcare practice at the Glover Park Group, then Glover Park Group. And then my partner and I, Megan Houck, started Nathanson and Houck on February 1st, 2011. So it is our 10-year anniversary this year. And we are really, really excited about that. And it is wonderful. I want to make sure we get to lots of questions, and I know Emily has a lot to say too, and Shane gave a great landscape. So I'll just say a couple of things about the Biden administration. Obviously, and all of you know, I'm looking at names of friends and people who I've heard of. So you're all well aware that there's just about as much health policy priorities as you could ever want or hope for in any Congress, and this is no different. The Biden administration has the overlay of a 100-year pandemic to deal with, which makes things quite different. But I think that they are in a situation where they are, as they begin to staff up now that Secretary Becerra is confirmed and those chairs begin to get filled, of how much work do they do looking back at the last 4 years and things that they want to correct, fix, keep, and how much of the work is looking forward, getting us out of the pandemic, looking at what the pandemic has revealed to us as a country and our healthcare system. And I think one area that you're going to see, regardless of whether it's look backs in the present with children at the border or looking at the future to how to shore up and strengthen our healthcare systems, is the fact that COVID truly revealed that rising tides or terrible circumstances do not impact all communities the same. They do not raise all boats. And what you will see as a thread in all of the health policy and probably all of the policy writ large coming through this administration is more of a focus on health equity, on closing gaps, and dealing head on with healthcare disparities, particularly in communities of color, rural communities, underserved communities that are historically hard to reach. And so, you know, we'll talk more in the Q&A with John about some of the specifics there. But I think for all of us in the work that we do and the analysis that we seek or do ourselves, really understanding that, you know, I think everyone sort of nodded their head to that, but these guys, it seems like they really mean it. And so as you're thinking about policies that are going to make a difference for your communities or for your organizations, really holding that lens in front of the policy, I think will hold everyone in very, very good stead. The last thing I'll say, and then I'll turn to Emily, and then we can get to questions, is, you know, I worked on the Hill when Senator Biden, well, President Biden was Senator Biden, and he is a bipartisan guy. And you've heard him say over and over again that that is a way, that is his preferred method of doing business. And we are watching right now, and I think it's actually exciting from a bipartisan perspective, the Senate taking up and likely to pass later today a sequester extension bill in a bipartisan manner that will go to the House. And my understanding is Speaker Pelosi will take that up after the 2-week recess. And so I think you saw, you know, this small but bill with great impact moving in a bipartisan way through the Senate, while you saw the American Rescue Plan moving because it required speed and necessity in a partisan manner. And I think you're going to see throughout this Congress that push me, pull you of, you know, things that are going to be done just by virtue of the fact that they need to be done, and there are not bipartisan desires to move something, while in another lane, bipartisan work happening. So I'm a bipartisan kind of person whenever you can. And so, you know, I just think that it's not as sexy when everyone works together and tries to find solutions as when people are yelling at each other, but it happens and it's going to keep happening. And so do not despair. That is where I will leave you. And then I'll turn to Emily.
Emily, the floor is yours. Thank you, Melanie.
Well, thank you, John. Melanie, I love that. It was a tough act to follow. First, thank you very much for the invitation today. I concur with everything that's been said. It's nice to see all of your faces and names. I am a partner at the Nichols Group, also a boutique healthcare, among other issues. We do tax, energy, homeland security, a variety of issues, but also a small healthcare consulting firm in Washington, D.C. But I really value the work of the Applied Policy. Our whole team does. And so just want to thank you all for the work that you do every day to keep us informed and on our toes. But with that, I think because let me give a little bit of background about myself. I worked in the House of Representatives for a little over a decade. I worked for a member from Colorado and Arizona before moving to the Education and Workforce Committee for Chairman John Boehner, who then ascended into the leadership. So was with him during his time as majority leader, 4 years in the minority, and then the Speaker's office. So my final job there was his healthcare policy staffer in the Speaker's office and facilitated any and all health legislation coming to the floor. But in my 8 years at the Nichols Group, I think it's been a good reminder of how much bipartisan work actually does get done in Washington, to Melanie's point. So I'm really glad that you said that. Having also spent almost 9 years working for a boss who I like to think was a true legislator and wanted to work in a bipartisan way with other members, I completely concur with what you just said, Melanie, about President Biden. I think he's also like that. I think there is also a time period at the beginning of any new administration where the top congressional leaders and the White House are figuring out how to work together. It's not going to be kind of a natural machination in the beginning. You'll recall, you know, Barack Obama and John Boehner and Harry Reid and Nancy Pelosi, they worked out some kinks in the beginning. And so I think this is going to be a very similar situation, that when push comes to shove, perhaps they can get some bipartisan things done. What are some of those bipartisan things? I thought I might name a few, just being the Republican and hoping for a little bipartisanship on the Republican side, since they are the minority in both the House and the Senate. But I do think that there's a lot of work that can be done to, one, increase transparency, to address mental health, as well as substance abuse. I think there's also a lot of opportunity to enable innovation. And as Melanie also said, preventing pandemics, shoring up the Strategic National Stockpile and BARDA and other programs so that we can be better prepared and more adaptable to, God forbid, the next time this can happen. I do think there's also some work that can be done to modernize the Part D program to reduce out-of-pocket costs for seniors. I think there's bipartisan agreement in wanting to get something like that done. I also think that there could be bipartisan work done on enabling greater innovation and cures, so curative therapies or gene therapies. I think also maternal health is going to be something that could be worked on by both the House and the Senate. Solving for racial inequities for certain rare diseases, FDA reauthorization. So there are a lot of things that I really do think can get done. And to Melanie's point, I think sometimes all of the oxygen gets sucked out of the room for things like HR 3 and the infrastructure bill. If it's paid for with tax hikes, Republicans do want to, a lot of Republicans, not all, but a lot of them would like to get an infrastructure bill done. But tax increases and things of that nature are just some lines in the sand. And I think that's where you're seeing a lot of the media surround that idea, but also ACA expansion and what form that takes, whether or not it is in the form of a public option. Obviously, there's some partisanship on that. But again, there are a lot of bipartisan opportunities, and I'm really hopeful. It is very early, even though I think because we're in a pandemic and a lot of folks are still working from home, time maybe seems a little bit longer, but it is still very early in the administration, and I'm hopeful for some good things that can happen going forward. So with that, thank you.
Thanks, Emily. And boy, it sure is nice to hear talk of bipartisan workings and how, you know, a government can move forward and work together and actually accomplish some things. So boy, I probably share this is shared amongst all of you. It really is. It's a time when we can enjoy, hopefully, a administration in Congress that can work and actually accomplish some things. So thanks, you guys. So you've touched on a lot of the things that we're going to ask going forward, but the oxygen does get sucked out of the room, especially when we talk about COVID. And so everything does relate to that, and that clearly is sort of an overriding challenge for our secretary. But outside of that, what do you think next? What should the next priority be that HHS should pursue, and how do you think that should be attacked? And so, Emily, I made you go last time, so I'm going to make you go first this time. Oh. So I hope you got a drink of water there. Anyway, I just think that the conversation so often goes to the top line, and that seems to be COVID. What do you think would be the one major challenge that the new secretary faces?
Just one.
Well, I just want you to pick one.
Yeah, I mean, I think there's a lot of challenges at the moment. Obviously, getting shots in arms and working with the other agencies, I think, to get children back in school. I think the situation at the border is probably a top priority also if I'm Secretary Becerra. I know the president is traveling down there, but to me, those three things are big things. I know you only asked for one, but to me, those are probably the biggest ones.
That's okay. Shane, thoughts about sort of non-COVID priority one facing?
Yeah, so I kind of follow what Emily was talking about. I really see the role of the HHS secretary is engaging with stakeholders, in particular governors, to Emily's point, on vaccination efforts, expansion of Medicaid, other things like that. Of course, HHS will play a role in public health with the border crisis and other things that he'll have on his plate. Then other things too, to look at, that they've placed on hold some, rulemaking and other things, and some of it I think they may like, from the prior administration when it comes to drug pricing and other things like that they're going to look at. So, what they do with rules and regs, now that you're starting to get staff back at HHS and CMS, and you're not having the acting titles, they may be a little bit more confident in moving forward. In certain directions like that. Another thing too, I mean, every healthcare meeting that I've been in the past 2 years, so, social determinants of health, we hear that. And I think to Melanie's point too about health disparities, I know this is going to be a priority. I've had a lot of clients that have worked in California with Secretary Becerra, and I think he will, do a lot of things to bridge gaps. And he's going to be doing that, I think, next week too, in encouraging vaccinations, certainly in areas too that will need some assistance. So with that, I'll turn it over to Melanie.
Yeah.
Thanks. So I agree with both Emily and Shane. I've worked with and alongside the secretary and his team, both at Ways and Means and in the AG's office in California for years. And besides his wife and daughters, I might be his biggest fan. So take all with a grain of salt. I just think he hung the moon, and we are very, very lucky to have him at the helm as secretary. When he was on Ways and Means, and even in his acceptance speech when he was nominated to be secretary, Mr. Becerra was very clear that there is, in HHS, there is health and there is human services. And oftentimes the human services piece gets lost, and he is going to prioritize that sort of co-direction and intersection between the different centers and agencies, I think more than we have seen in the past, if ever. So that means when we're talking about dealing with the border crisis, it is the people working at the Administration of Children and Families and CMS and SAMHSA and HRSA, everyone working along with each other. And I think you're going to see, and it's hard to do in a bureaucracy where things are so siloed, just by virtue of the structure of the administration. But I think you're going to see at least a valiant attempt to try to get different agencies and centers to do more together, to work better together. There are lots of different streams of funding that can go towards solving for a lot of the problems that we have. Oftentimes those don't interconnect. And I do think that he is going to make it a priority to have better communication and better integration across the centers and agencies in the department, and also across the different departments. So, I think some of the benefit, and many of you work on this now, of having relationships, and we all know how important relationships are to the work here in Washington and in general, I would say. He and Marcia Fudge, who is now Secretary of HUD, have a long and strong working relationship together, and the intersect between healthcare and housing has been sort of put under a microscope during COVID. We just see how important it is to have safe, affordable housing that's not in jeopardy to healthcare. And so I do think that you are going to see a premium placed on trying, I'm not saying succeeding, but trying to really address some of the cross sections within the context of healthcare that frankly, and it's no fault of their own, but when you talk to, many of you have had this, when you talk to folks at the Center for Medicare and something comes up on transportation, they're like, we don't do that. And so I think that there's going to be a lot more of a premium placed on trying to break down those barriers to afford higher quality, better care, coverage, and health in the country.
Great, thanks. That's I think that's terrific. That's terrific insight, because we get so lost with the media following just the loudest headlines, and so it's nice to hear some of the things that may be going on in the background. We just had the anniversary of the signing of the Affordable Care Act, and there's been lots of continued discussion about what will or would not change in that. President Biden spoke about building on the ACA to meet the healthcare needs of the country going forward. So Melanie, I'm going to go back to you since I'm reversing order again, but what improvement or change do you think is most likely to actually happen with the ACA? Or if there are multiple ones, what do you think that short list looks like?
Sure, thank you for that. So I'm going to say just at the top to get it out of the way, I don't think that we're going to be having comprehensive conversations about Medicare for all. And while I do think that we will see discussion, and certainly maybe not in the skinny budget as Shane noted, but in the broader budget, we'll see policy around a public option and designing a public option. We may even see some proposals around what that might look like, but I don't think that's imminent. I think that those will be discussions that will be ongoing. It'll be interesting to see how, whether working groups are formed, whether you have a TED, I don't know how long some of you have been here, but before the ACA, as they were designing it, Ted Kennedy would fill the caucus room with stakeholders and be like, tell me what I need to know. What should I do? What are, and so I think around the public option, you may see perhaps not to the grand gesture of a Ted Kennedy, and nobody can out Ted Kennedy, but certainly, really pulling from different stakeholders to try to, if there is a public option, not have it just be a political football, which frankly it is right now, and have it be something that's real. I do think, though, that the rescue plan really highlighted and underscored improvements to the ACA that we haven't seen since the ACA passed, and many people have been trying to do for the last 11 years. So better structure of subsidies, more for navigators, consumer assistance programs, and other features to help people not only get enrolled, but understand what their coverage looks like. And of course, Medicaid expansion incentives for those states that have not taken up the expansion. And right now in Wyoming, for the first time, the House yesterday passed a Medicaid expansion bill. The Senate is working it through right now. And so, and it is, I would argue, and Emily can tell me if I'm wrong, that the reason that Wyoming is even considering this at this point is because it's a pretty good deal for states that have not expanded. It's a lot of money to say no to cover a group of people in your own state that are currently uncovered. So I think that we'll see more of that. And I do think that then in the next wave, and I agree with Emily, and I think there's a lot on the public health side, AMR and the BARDA side that will be of import and interest. I think on the ACA side, making a lot of these improvements that are 2 years, 3 years, just by virtue of the reconciliation design, making them permanent, making them go for longer, will be top of mind. It's like, we did this, we got this, let's keep this. So I think that's next up.
Great, thank you. Emily, thoughts on something that you think will be different out of the ACA going forward?
I mean, look, I think that there are bipartisan achievements that can be made in terms of providing coverage. I think there is still a gap between the two parties in how they view lowering costs. and lowering costs, I think, is still the #1 issue. And so whether or not there are, I think, bipartisan efforts in terms of bringing Republicans into those conversations remains to be seen. But I do think Republicans want to be a part of those conversations. And whether that's through tax credits or risk pools or letting states have greater opportunity over their own innovation. But I think those are things that if honestly, if I'm a Democrat and we've just won the White House and we have the House and the Senate, I mean, I think it makes a lot of sense that they would want to move forward with some of their priorities on the ACA. It has been a decade. And like with any law, there's improvements that can always be made to any law. So I think, again, there will be partisan conversations about this over the course of the next few months. But I think my hope is that they can disagree without being disagreeable and eventually find some perhaps smaller reforms that they can agree on together.
Mhm. Thank you. That's great. Shane, where would you put your money on some
So
change?
when I think about the Affordable Care Act, to me, it was really about accessibility to healthcare. You couldn't do everything at the time, or you'd lose one senator, and that was it. When we had 60 Democrats in the Senate, so drug pricing, reforms really couldn't happen given the significant amount of lobbying that was, going to happen. And then when we lost a Democrat, we're at 59, and then that just wasn't going to be a possibility. So some of the things that we're talking about regarding, public option, that was in the House bill. The Affordable Care Act was a Senate bill, where there was no conference because they needed to have every senator on board, and then the House just had to vote up or down. But public option was in the House, in 2009 and 10, and didn't make it through the Senate. So I don't know how public option, would fare in a 50-50 Senate. And I know, like, Kirsten Sinema is not a fan of the public option, either. And I know, if you're looking, at expansion and having sort of a Medicare-like plan that would be offered on the exchange. I know the Kane, Bennett bill, I think is one model, to do that. And they've got about 12 Democrats. So I really don't know kind of where, Manchin is, but I think it'd still be difficult to do something like a public option. And I know some states too have struggled, Washington State, for example, and how they negotiate the rates with hospitals too, and pricing. So, something, and of course, Medicare for all, I would agree, that couldn't pass the House. You've got about half of the House caucus that's on a Medicare for all bill. But, something perhaps that would be in the middle that would split the difference, perhaps, age 60 Medicare. We came close in 2010. I think it was age 55, if I remember correctly. But age 60 could be something. That could be a possibility if you make the argument that MA plans too could expand their market on that. That's something that, like, first responders, public safety officers are very supportive on. Many of those professions, you have to retire at age 55, and some of the public pension plans don't offer health care. And then you also have about 25% of public employees that don't get Social Security. And so affordability, is a big deal, for them to try to get access to a plan. So that's attractive. And of course, the International Firefighters were the first major, in my view, public safety organization to endorse President Biden. And that's one of their top priorities. So, if you do see this infrastructure / drug pricing bill go through, there's going to be, others that are going to want to have other things included that could be eligible for budget reconciliation, and maybe age 60 Medicare could be one of those things.
Mm-hmm. Great, thanks for that. So Shane, you touched on the drug pricing piece, and there a question came in. By the way, everyone, feel free to text me or chat me a question or two. We'll keep the conversation going, but love to have the interaction. So you guys can probably see the question that's on the list there. But so Shane, why don't we just go back to you for a second here? What about the drug pricing, and how might that be addressed in the infrastructure package, since you mentioned drug pricing?
So, the way that it's been explained to me is that they would look at the savings that is created through that package of HR 3 to pay for other things, perhaps in infrastructure. And it's an interesting way to tackle a budget reconciliation bill. I remember, talking several weeks ago, a friend of mine that worked in the Trump administration and Bush administration, economic advisor, and he says, there's no way, you're going to see healthcare reform because they're going to infrastructure. And I was like, well, I'm hearing that they may also include healthcare in an infrastructure bill. And maybe, and Emily and Melanie have done this for many, many years too, but I've not really seen how that's been pieced together. But I think, this was a priority for Speaker Pelosi, HR 3. And I think they see this as something that I know a lot of my clients care about: public pensions, first responders, that they pay these checks every day, every month to their health plans for drug pricing as a means to perhaps, see if you could get that bridge and get to 50 senators in the Senate. And so that I think is an opportunity, for them to start from, and then other things can be added onto it. So I do think that drug pricing is not going to go away. I think that they're going to try to see if they can figure out a way that they could package something that would be accessible, especially to the centrist on there. I always like to see bipartisan, deals go down. I don't like to see partisan bills pass, which budget reconciliation avails itself to a partisan process. I would like to be able to see things happen through rules and regs too at HHS. And I also think that the FDA commissioners plays an important role on these, where they can do other things to accelerate, generics and biosimilars that I think a lot of payers care for. I know that'll be a priority too, at FDA to see some of those things happen.
Thanks, Shane. Emily, thoughts on drug pricing infrastructure beyond what Shane had to say?
Sure. I mean, I think, like I said in the opening, a lot of Republicans do want an infrastructure deal. A lot of them have been hoping for one for more than just the past few months, and it's been a topic of conversation for the past couple of years. So I think there is a lot of energy that would be, they'd be willing to put in the time to get to a bipartisan deal. I think that, again, there are lines in the sand, and tax increases, I think, is one of those lines. And the Senate Minority Leader has been very clear about that. And Republicans just aren't interested in trying to pay for it with tax increases. I would say that's probably the same when it comes to also policies that are a part of HR 3 that they've already voted against. So I think there was also the question in the chat about where the chamber and NAM will come down. And I think that will depend, obviously, on the content of the legislation. I mean, this is where the Democratic majorities need to determine what they want to do on a partisan and a bipartisan basis. And there's also the overlay of the discussion about getting rid or changing the filibuster in the Senate. So I think you've got a lot of dynamics that are sort of working together, and some are playing against each other at the same time. But I think it's really going to be kind of a inside the family conversation in terms of how they want to move forward with this. Reconciliation is a very special process, and it's a little bit like gold. And so when you have that opportunity, you want to take it. And it is often a partisan process, unfortunately.
Thanks. Melanie, I don't want to cut you out. You like to add anything?
Don't cut me out, John.
No, I'm not going to cut you out, I promise.
So just a couple of things. I think, the pandemic, again, sort of colors everything. But when you talk to members, they will tell you that when they go home, what they still hear most about is crumbling bridges in their communities and the high price of their drugs. And nothing's been done about either of those things really effectively. And so even with the 100-year pandemic, these bread and butter, these are the things that I see every day. These are the things that impact me every day, whether I have gotten a COVID vaccine or not, are these things. And for, as long as I can remember, at least for the past 4 years, but I'm sure beyond that, every month we had infrastructure week that lasted from, 9 o'clock on Monday morning to 9:05 on Monday morning, and then it was over. And then lots of discussions about HR 3 versus the the Wyden-Grassley bill. And I do think that, there's still real interest, particularly Chairman Wyden, in trying to find that bipartisan path forward. Now, what's interesting is that he had a comprehensive bill with then Chairman Grassley. Mr. Grassley is still on the Senate Finance Committee, but the person who essentially authored the counter bill to Grassley-Wyden was his new ranking member, Mike Crapo. So it makes it a little bit less clear how Senate Finance is going to operate with regard to a prescription drug bill, whether Grassley and Wyden continue to try to move HR 3 more to the center. Is that possible? I do think that certainly Speaker Pelosi and Chairman Wyden very much want to see something get done here. I do think that, the discussions around prescription drug legislation, and then rolling back some things like President Trump's rebate rule, EO, which if it's done legislatively garners significant billions of dollars worth of savings, are on the table to pay for something. I do not have a crystal ball to know whether they can split the baby and do an infrastructure bill that is paid for at least in some part by prescription drug legislation and a rollback of the rebate rule and some other things, and then use tax increases in the construct of a reconciliation bill that does more on the healthcare, public health, climate side, where you don't have consensus around the policy. To me, that seems like a logical step and process. But I just don't think we know yet. I don't think we know what the tone and tenor of the chambers are going to be. I don't think that we know, how long it's going to take us to get to a point where we have most of the country vaccinated and there's some kind of herd immunity so we can move on. But as long as COVID is still a thing, it's still a thing. And it's going to be the number one thing that this administration and Congress are going to have to contend with.
John, can I just say one other thing? Because Melanie just sparked in my mind. One thing that I do think is interesting as we talk about whether or not pieces of HR 3 will end up in an infrastructure package or another reconciliation bill. The pharmaceutical industry is very good at evading a lot of bad policy. And they're also really unique in that to have delivered such innovation over the past year, and then to still be among one of Congress's top targets, it really does make them, I think, unique amongst other industries, but they are very good at evading a lot of bad policies and negotiating. So I just wouldn't also underestimate them.
No, I think that's a valid point. Thanks for bringing it back. There's a question on the chat about sequestration, and I did want to touch on that because I know there's some fairly current news on that. So Emily, I was going to ask you, about the existing moratorium, and why is it a controversy? And maybe for a little bit of a level set, you could just sort of give a 3-sentence or 5-sentence, what is sequestration?
Sure. It's it's a cut to Medicare providers. So it was created as a way to help offset spending elsewhere. And it's kind of become, if you all remember the SGR, it's kind of become the new SGR that Congress has to go back every few months or years to help avert the cuts to providers. And they're significant cuts, particularly when you take into account the past year with the pandemic and what they've experienced. So I think Melanie probably knows a bit more about this today in terms of how the Senate majority is going to move forward. But I think there's the bipartisan desire to try to fix the sequester. I should add too, there's also the PAYGO issue that was a part of the COVID package that the president just signed. So that the bill would avert the 2% Medicare sequester cuts, but also avert a 4% cut. But again, that is on the PAYGO side. So in an effort to sort of even out the ledger is also a part of that, which again is important to Medicare providers.
Mm-hmm. Yeah, thank you. Anything to add, Shane or Melanie, on that topic?
No, I mean, I agree with Emily. It's kind of like the Cadillac tax. We kept kicking the Cadillac tax, down the road and addressing it until we finally dealt with it. So it seems at some point it needs to be addressed so that the hospitals don't have, because they're dealing with so much right now anyway. So.
All right, thanks. Yeah. So I'm not exactly sure who to pose this question to, but another good question in the chat about the flexibilities of telehealth that we've seen expand throughout the COVID time, and it's likely that it seems like it would be something that a lot of people could get behind. I'm gonna open it up to whoever raises their hand first here of the three of you. What do you think about the possibilities of maintaining some of the significant advances we've made with telehealth from a policy standpoint?
I think everyone's already there. So when I think about things that are bipartisan, bicameral, that members can get behind, and we hear over and over again, it is the recognition that there's a place for telemedicine in modern day healthcare and we should use it. That there is a gaping need for more on behavioral health and we need to figure that out. And that we did not do everything we needed to do to combat the substance use disorder plague in this country, and it requires a lot more attention. And so if I was going to pick 3 things where you could sit in a room and not be able to differentiate between Republicans and Democrats, those are the 3 things. And I do think that, you know, we've already seen Energy and Commerce spend a lot of time, Ways and Means as well, help doing hearings around these issues. I think members are trying to figure out what we know and how far to go, frankly, in sort of making permanent the expansion of telehealth in the Medicare program. Obviously, Medicaid states can do that now. So, you know, I think it is more about how to do it right, where people are getting what they need, where we are not sort of opening the doors for potential waste, fraud, and abuse unnecessarily. Those are the questions, but I think it's a how do we do it, not do we do it.
Great, thanks. So we've got a couple more minutes here that I wanted to, we haven't really even touched on Medicaid expansion, and I kind of wanted to make sure that we at least got a quick in on that. So very quickly, it's, the whole discussion of Medicaid expansion has been out there. We've been listening to it for a long time, 10 years maybe. But today, given what's gone on with COVID and the stresses that's put on some of the states, you mentioned Wyoming before, are there other places where we think that, states that are traditionally sort of adverse to this idea might actually be starting to think about it more beyond that? And so I thought I'd ask that to start with Shane, but I'd love to hear everybody's thoughts on that before we wrap this up.
So, I'm from Louisiana, and a red state with a Democratic governor, John Bel Edwards, and he campaigned on Medicaid expansion and won in red Louisiana, and he just talked about how Louisiana's tax dollars are going to fund other states, and he teamed with hospitals, health plans, that do it. And so if there's governors that are looking at it, I think they could look at the Louisiana example. And I always try to figure out ways to bridge, public health with private sector. And I think he did it in a good way, because Medicaid is mostly managed by MCOs and health plans. And so I feel like if you could get with the providers and health systems, and then look again at some of the extra benefits that are flowing down with COVID and the challenges that's posed, that governors will relook, at opportunities to expand. And then, Republicans too have done, I think, like Senator Cassidy from Louisiana, where I'm from, he's trying to allow prisoners in their last month before they leave prison to gain access to Medicaid. Some of them, have previously dealt with substance abuse and others, and I've heard, behavioral health mentioned here as well. So there's a lot of innovative things that could go on with Medicaid that governors can take advantage of. And I think that this administration too will look at 1115 waivers and other things that would help them, perhaps if they want to, give them some flexibility, to do that. So those are my thoughts.
Thanks, Shane. Melanie, opportunities for expansion?
So, depending on, I think everyone was surprised that Wyoming went, and, I've never watched more Wyoming state legislature floor than I have this week. And what was interesting listening to the debate, particularly among the Republicans who supported it, is, they all made a point to say, this was on the floor in 2014 for the first time, and I voted against it every single time, and the time has come to do this.
Right.
And for all of the reasons that we all know are the reasons. And so I do not know, the Senate is more conservative than the House in Wyoming. I know the governor, Republican governor, supports it. So I think it'll be interesting to see over the next week how that shakes out. But my understanding is that, you know, Alabama, Kansas, and North Carolina are all looking seriously at this. And I think, you know, what happened, the quickness of the dominoes falling, I think Wyoming is a big factor. If Wyoming goes, I think you see things happen faster. If Wyoming doesn't, I think it takes longer. I'm from Georgia. You know, it's hard to see, but I did not expect to see John Ossoff and Raphael Warnock as our state senators either. So, you know, hope springs eternal. And I do agree with Shane that really having all of the different, you know, the provider groups, the hospital associations, the chambers of commerce, all who, you know, have traditionally supported expansion, being more overt about just what you leave on the table if you say no at this point, it's really important.
Emily, I probably should have started with you on this question, but final
No,
thoughts.
I honestly, I agree with what's been said by both Melanie and Shane. I obviously think it's a different year too. We've also had the pandemic, and unemployment, I think, is something that governors are trying to respond to. And so I think you're also seeing just different attitudes towards Medicaid expansion that just didn't exist before for that reason. So I concur.
That's great. Well, thanks. Well, this has been fantastic. What I'd like to do now is ask you three to give us, you know, your final thoughts in the last few minutes that we've got here before we close it up. And so, Emily, I'll just go back to you since you're on the left side of my screen.
Oh, okay. Sure. Well, you know, today is the first day of regular order in the Senate. So it's the first time they're doing bipartisan legislation this Congress. So I think that I think someone said earlier, you know, hope springs eternal, and I'm hopeful that, you know, some of the kinks we've seen so far can be worked out, and that there can be a lot of bipartisan legislation that does actually get done. And I think that's often just underreported, but is very important, particularly on the public health side. So just thank you again for the invitation, and really appreciated the time today. Thank you so much.
Thanks, Emily. Melanie, final thoughts?
Well, I guess I could just say what she said. I agree totally with Emily. I feel really hopeful that there's just a huge amount of work to do in this country to get us back on our feet. And I think that we are up to that challenge. I'm really, really so edified to see what's happening on the Senate floor right now, more of that. And I guess what I would say, and we didn't really talk about it today, and I think as Emily sort of referenced, it doesn't get talked about a lot. There's so much good work to be done on the public health side that is generally bipartisan. We have the UFAs coming up next year. I think much of what was done, you know, within the context of substance use disorder and other things that just really need to be fully addressed happen that way. And so I know every single person on this call works in this space and probably works on things that nobody, you know, that don't make the front page or even A6 or whatever it is online. But I think that there's just huge opportunity to get things done. And the small things federally are big things across the country. And so, you know, let's just all keep working on all of it together.
Great, thanks. Shane, final thoughts?
Well, I agree with Emily and Melanie when they mentioned so many things that can be done, and like reauthorization of FDA and other things that leaves me hopeful that that could actually lead to some other, you know, big things that can happen. I think the introduction of earmarks, I'm an earmarks fan, could help too. You know, with some of this, hopefully, in the bipartisanship, and really hope that the deals can be made. You know, again, compromise is the glue of our democracy.
Right.
So I would love to see that lead to some avenues. Obviously, infrastructure is where a lot of earmarks normally go through, and maybe members again can work deals out like they used to, and we could see, you know, some other things, you know, happen on a larger scale. So I am actually very, very optimistic now, having done this session with Emily and Melanie. So I appreciate it.
We're up to everyone here. I feel like we have so much progress done.
Yeah.
I know.
I love it. I love it. That's fantastic. Well, you guys are great. Thank you. So for all the rest of you, We will be holding another forum, another Northern Virginia Health Policy Forum in April, though we don't quite know when yet. So stay tuned for that invite. A couple of sessions that we're hoping to put together in the coming months. We hope to do something on this, the new administration's discussion around health technology assessment entity and what that might look like and how other countries are doing that. And also another topic we're working on is President Biden's war on cancer. So those are topics that we hope to touch on, but we'll be putting out an invite soon. So please stay tuned for that. So last all, thank you, Emily, Melanie, Shane, you guys were just awesome. We have really heard a lot of good stuff today. And I know I share everyone's thought and saying thanks for your time and your really thoughtful answers to these questions. You all take care. Thanks so much for joining us.